Hello, everyone. Well, we are going to be talking about Panchakarma. Panchakarma is a scientific and evidence-based therapy of Ayurveda, which has a lot of research, which we'll talk about later. But to present this topic, we have Vaidya Manju. Vaidya Manju has been a clinical pharmacist for over 15 years, and now she has transitioned herself into the world of Ayurveda. So, namaste, Vaidya Manju.
Namaste, Amitaji. Namaste. Thank you for having me here.
Great.
It's a pleasure for me.
Yeah, so I think before we get into the Panchakarma, as a clinical pharmacist, for you to switch from being a very conventional medicine dealing with all the drugs to coming with now, to Ayurvedic therapy, tell us a little bit about your transition and what your thoughts are.
Yeah, I think the reason I switched is because I was a pharmacist, because I knew that every time patients would come in, we would always increase the dosage of the medication versus finding out what is causing this. Mm-hmm. We come back saying my lab values increased, and the only answer we have is either we increase the dose or we will add another category of medication. Yeah. And it felt like we were always managing, but never addressing the root cause. That's when I was like, okay, this is not how it's supposed to be. Mm-hmm. And thankfully, I was able to find our ancient roots in the name of Ayurveda. And I was very curious, and I thought I'll just do it for myself, my family. I never thought that I'll take it up as a career at all. Mm-hmm. That was never in my mind. I thought I'll just do it for myself, my family. But then when I started it and I started introducing it to myself, started introducing it to my friends, mm-hmm. there's tremendous difference with just a little bit of changes. And then I was like, okay, this has to be brought to the world. The world has to realize how much potential this therapy has. And that's why I think things just got aligned. And I'm so glad that I'm not a clinical pharmacist now and I'm an Ayurvedic practitioner.
I think it's a beautiful story. And like I said earlier, Panchakarma is one of the therapies that has a lot of evidence. So let's just go through exactly what Panchakarma is. There are 5 therapies. That's what we understand, but we don't understand the depth of each one of them.
Absolutely. Absolutely. So Panchakarma is a buzzword, actually. A lot of people would call me. They're like, can I get my Panchakarma, please? That's how they call. And I'm like, okay, I'll have to decide if you're eligible, because everybody thinks that Panchakarma is for anybody and everybody. But Panchakarma is this deep detox that is given to us by the ancient rishis. Mm-hmm. With all the exposure that we have in the form of food, in the form of thoughts, in the form of environmental exposure that we have, mm-hmm. we accumulate a lot of toxins in our body, knowingly and unknowingly, right? Because it is chemicals that are produced every time you insert anything inside. So it's like our body is a chemical laboratory.
Yes.
And depending upon what you insert in it, there is a lot of accumulation that happen. Mm-hmm. So with the Panchakarma, what can be done is this deep cleansing of the house. Mm-hmm. Like what you do in India, what we were used to doing is any festival comes up, we would deep clean the house. That's how a festival, a Dashera or a Diwali, it's like we have to deep clean the whole house. Mm-hmm. And then we can celebrate it. Just like that. We deep clean all of the toxins that are present in the body, mm-hmm. so that we are able to function again, so that we can celebrate life again. That's really what Panchakarma is. It's a deep detox.
Okay. So let's talk about the 5 therapies that Panch means 5, right? It's a Hindi word, but means 5. Yeah.
Correct. In Sanskrit, Panch is 5, Pancha is 5, and Karma is the procedure. Mm-hmm. So I know normally everybody, Panchakarma, they're like, oh, Shirodhara is Panchakarma. Oh, Abhyanga is Panchakarma. Mm-hmm. But really, they're not a part of Panchakarma at all. Shirodhara is not a part of Panchakarma. The 5 techniques that are present is Vamana, as to begin with. Mm-hmm. The second one is Virechana. Mm-hmm. The third one is called Nasya. Mm-hmm. And there's Basti. There's different types of Bastis. And there is Rakta Mokshana that is present. Mm-hmm. So the first one, when we talk about Vamana, is more emesis. We create this emesis. We prepare the body first. We give good amount of ghee to the body, mm-hmm. so that there is a lot of soaking that happens. Mm-hmm. Because these toxins that are present are not ready to come out. They made this a home. They're like, I'm living in your body. I'm not ready to come out. They just get stuck there.
Yeah.
And it's like your vessel that you burnt, and it's difficult to remove whatever is stuck there. And if you try to remove it, you're going to make all of those scars on the vessel itself. Instead, what you do is you have to soak it and carefully remove whatever is stuck. Just like that, we're going to give ghee, good amount of ghee. It's medicated ghee. It's not a pleasant experience to begin with. It's bitter ghee that you drink.
I see.
That we have to observe what are the changes that happen in the body, and depending upon the changes, we change the dose every day. And then finally, we come to know that, okay, you're now ready. You're now ripe and ready to remove all the toxins. Then we look at where are the toxins located. If they're located in the upper part of the body, and because this is the closest route to remove it, then we give decoctions and we remove whatever is accumulated in this part of the body. And the second technique, which is virechana, is purgation, where we give different medications or decoctions if it is accumulated below the umbilicus. If we notice that the toxins are accumulated below the umbilicus, we know that by different methods. We check it with the nadi, we check where it's accumulated, we check it that it's accumulated below the abdomen, then we give medication for it to be purgated downwards. Those are the first two. The third one, the basti, which is enema, that's what we give for any vata disorders, any disorders that has excessive wind element in the body. To reduce that, there are two different kinds of bastis that are given. One is oil basti. We just give oil as an enema and oleate that whole area because of lot of dryness that is created from a lot of exposure, not sleeping in the right time, eating dry foods. A lot of dryness is created in the rectum part of the body. And that's where the wind element makes it as a seat. So to oleate that region, we give oil enemas. And the second kind is decoction enema, to create and to remove any of the toxins that are accumulated in that. So we have to carefully assess, is this panchakarma that we're doing to rejuvenate this person or to remove whatever is accumulated?
Got it. So I just want to ask a question. So there's so someone could have an ailment, for example, right? So Panchakarma, so first step would be whether it's simple rejuvenation, which there's a lot of buzz about detoxification, rejuvenation. So that's a simple Panchakarma. The second step would be if someone is having some kind of an ailment like arthritis or blood pressure, what have you. So these are two different things, right?
So when they first come in, you're talking about rejuvenation technique is we would have to understand what's happening. And it's not like the person is ready to begin with Panchakarma immediately. We would have to make sure that any undigested food that is present, we need to digest it first. And that is possible with the type of herbs we give. So that's the first step that we start with. We make the body ready. That's the first step. And the second step, if we think that these are very, adamant kind of toxins that are not going with any of these simple techniques that we're doing, change in diet, change in lifestyle, giving herbs, all of this is not budging these toxins that are very strong, and this is very chronic, then we go for these techniques, which is like a surgery. It's like a surgery removing anything that is unwanted in the body.
Got it. But obviously natural. Now, so there is, what are the tools? Like you said, you do pulse diagnosis to understand, right, what's happening when a client walks in versus after 1 week of when you've given the herbs and nothing happens. Is that how you do it?
You're saying the first step, when would you decide if the Panchakarma is needed or not?
Exactly.
So we would look at the symptoms. When the client walks in, they would have certain symptoms and they would have certain goals. Each person has a different health goal, and we would have to understand what the health goal of the person is.
Yeah.
And we would look at every week. We would look at, okay, are we meeting the goal? What is happening with the herbs? Are the herbs strong enough to take care of it? However, if we know that we call it hetu bala, which means the causative factor is very, very strong, which means that they would have had not a very good lifestyle diet for many, many, many years.
Yeah.
But they need results like immediately like that. Then a full scoop is necessary, full scoop of whatever is accumulated. And for that full scoop, Panchakarma is the answer. With the herbs, what we're doing is we're just scraping. Okay, we're scraping. But if the toxins are so much, then scraping will not lead anywhere.
Yeah.
And that's when we would decide, okay, do we need Panchakarma or do we need to give herbs? And we also look at what's the timeline that the client would invest in, because they need the results quick. Then we're like, okay, maybe we can do this Panchakarma, but we need to make sure that the person is strong enough, because like I said, to take the decoctions and to be able to vomit out, because it takes a lot of strength of the person as well. So we need to make sure that the person is strong enough to be able to withstand all of these decoctions that we give them.
Sure. So let's talk about the rest, the other two, which.
Yeah. So the other two, the fourth one is called nasyam, which means we give medications. There's so many different kinds of medications that can be given through nose. Nose is the doorway to the brain. So anything that you have in this area, like sinus, allergies, anything that you're suffering from in this area, like tinnitus, vertigo, there's this kind. So this is the closest route. Nose is the closest route where you can give medication and you can remove whatever is accumulated in this area. That's the fourth one. And the fifth one is called Rakta Mokshana, which unfortunately we're not able to practice that here in the United States, because it involves removing of the bad blood. Because if there's shingles attack, or if there is any rash that is present, or if there's burning, intense burning, itching, all of that's present, that there is a specific area where there's bad blood. So there's actually leeches that we put on that area to suck the bad blood out, or we do something called, we remove just the blood out with the catheter, with a small catheter. So those are the things that are done, and it's effective. It's like effective immediately. You see that your senses are completely different. You see the world as a new place. You can hear better, you can smell better, you can taste better. Once all of these toxins that have made it home in your body are all removed.
Sure. And then the fifth one, what you were talking about, the Rakta Mokshana, Chinese medicine also has a similar thing. And in fact, I got that done last year. Yeah. So what they were doing is not put the leeches on you. They have the needles, as acupuncturists use, and then prick the needles, on the infected area multiple times. And then obviously the blood is coming, and then they'll put the cup on top of that, and then suck the blood, the bad blood, what you're talking about.
Correct. That's one of the techniques that's available in Ayurveda as well. Alabu is what we call the cupping method. That was described 5,000 years ago as well. The cupping method that's present, we create heat and then we create a small cut there, so that blood that gushes to that area from the heat will just be removed from that area, and immediately you must have received some kind of you must have received, the symptoms must have reduced immediately for you if you've done that.
Absolutely. So the question I want to ask is, so many people right now in India are suffering, right? So many problems are happening. Is there anything that you think from Panchakarma that people can do by themselves at home to help at least improve the immunity, the immune health?
Unfortunately, Amita, right now, when you're going through so much fear, and when there is so much going on around, your mind and body must be strong. Both of them must be strong for Panchakarma to be done. And your Panchakarma must be done only in front of a qualified person.
So nothing can be,
There are a few things that I do let my clients do, but not for improving immunity. For improving immunity, there are so many things called rasayanas that are present, especially with gold-infused rasayanas that are present in Ayurvedic herbs. Those can be given every day, like gold-treated water that you can drink every day. And there are so many herbs that can be taken every day to improve your immunity. That is boosting up your immunity. But Panchakarma is mainly for removing any of the excessive toxins that are present in the body. And doing that in a crisis situation is probably not a great idea. But doing that every year is recommended, especially during spring and fall. Spring is for Vamana and fall is for Virechana. If you do it during those seasons every year, then that means you are removing those accumulated toxins and you're getting ready to be able to absorb and assimilate the regular food that you eat, which will in turn give you immunity. And then take those rasayanas as well.
So the thing, yeah, the essence is do this in front of with a qualified Ayurvedic practitioner, and then a maintenance of our cells, which all of us actually ignore. We should take it very seriously, especially what is happening now that all of us are watching, right, in India.
Absolutely.
And anything else that you would like to add on Panchakarma? Well, Panchakarma, obviously, we cannot do it at home. That's the question I wanted to ask you. If there's anything I can do it at home.
One thing that can be, normally what we ask you to do is probably the Eranda Sneha, which is castor oil, is something that can be taken probably once a week, like castor oil. Okay. 10 ml can be taken either with warm milk, like 50 ml warm milk. You can add like 10 ml of castor oil, provided you don't have excessive mucus in the body. If there is excessive mucus, that's probably not a good idea. But if you don't have excess mucus is manifested by a lot of runny nose, sinuses, all of that kind of situation. Then you can take castor oil once a week, which can be like a purgative, removing toxins that are present, and that is safe. Nice. You can definitely do that. And if it's not palatable, you can add it to your like roti atta that you make, which can make it palatable as well. Or add it to your warm water, warm milk, just gulp it down. That is something that you can definitely do. So it's not a Panchakarma, definitely not a Panchakarma, but it is some kind of cleansing that you can do once a week.
Okay, and that would be coming out of the vomiting, or that would be coming
down.
Okay.
Correct.
And what about ghee? A lot of people say but is that recommended that you have ghee on a regular basis?
Are you talking about regular ghee?
Yeah, regular ghee, not medicated ghee.
Yeah, regular ghee can be taken every day, but that's not a detox. It's not for Panchakarma. The regular ghee that you take along with food is like your rejuvenative, is something that will help you and will give you a lot of strength to all your tissues, so that you're making your body, you're building up your own soldier force to fight against any of the enemies. That's how ghee will build up your tissues. But it's not a detox. Just a regular ghee is not going to be acting as a detox.
Got it. That has to be a medicated ghee, what you said.
Correct.
Right? As part of Vamana, and Vamana is the one that you said the ghee is given and then you bring it out.
Correct.
In Varechna, what do you give inside?
You give ghee as well. You start with ghee. So ghee is really soaking up your toxins.
Yeah.
And at the end, we give decoctions to remove whatever is accumulated.
Got it.
But ghee is given, this medicated ghee is given to soak up all the toxins that are present. And that is given in bigger doses, like 30 ml, 60 ml, 90 ml, 120, 150. It's given in bigger doses.
Sure. No, I think this is very informational. I mean, it's amazing therapy, Panchakarma. Unfortunately, all of us have to go in person. We cannot do anything online through Zoom.
It's not recommended. I know a lot of practitioners do like a spring cleanses and these things. You can do it. You feel right. You feel good for one point of time. But the reason we give ghee to begin with is so that it does not aggravate your wind element later on. What happens if you don't protect your tissues, then you're scraping your tissues by doing these toxins. And your tissues are not going to be strong enough. Yes, you'll feel good because all the toxins that are accumulated are removed from the body. But what happens to your strength? We need to make sure that your strength is protected.
Absolutely.
That's the first rule of doing Panchakarma, or first rule of doing any kind of treatment.
Correct.
So that is the reason we insist on doing this. But I know there are some spring cleanses and fall cleanses that are available, which just came up, but they are not written in the ancient textbooks.
Got it. Thank you so much, Vaidya Manju. I know you have your Panchakarma Center in Bay Area. So, I haven't tried Panchakarma myself. I want to try it one day. So maybe I'll come and try it out at your center one of these days.
Absolutely. My pleasure.
To all the people, if you have any questions, I know it's kind of middle of the day today, but later on when you're watching this video, let us know if there are any questions. But the essence is Panchakarma is deep cleansing, right? To make it very simple.
Correct.
Deep cleansing of your body, and with your body, if you deep cleanses, your mind is going to be cleansed as well.
Absolutely. It's a full cleanse of body, mind, and soul. That's what it is.
And try it out. I mean, I personally haven't tried it out. I'll be honest with you. I've tried a lot of other things, but not Panchakarma. I get too scared, when I see the vomiting and all those.
It is scary, but we will be there. We're responsible for everything when we.
Yeah, absolutely, absolutely. But Panchakarma also can be used for a lot of other ailments as well. There's a lot of research and science behind it, right?
Absolutely, absolutely. It's very much helpful in a lot of chronic conditions. Many conditions that are not that do not have an answer in allopathic world.
Yes.
You see, there is magical results that you see.
Absolutely. Thank you so much, Vaidya Manju, for being with us, and to everyone else. Stay safe in India. To all the people who are watching or will watch later, give it a try, Panchakarma.
Absolutely. Thank you so much.
Thank you. Bye.